Hello, I'm Blessing, and did you know that October is Breast Cancer Awareness Month? Well, the color is pink, but I'm not in pink, but it's okay. Join us this October as we find out what people know about breast cancer and their little message to breast cancer victims.
What is breast cancer? Breast cancer is a type or a kind of cancer that develops in the breast, and it's more common in women, and it also happens in men actually, yeah. And it all starts when the cells of the breast start to grow out of control. This is breast cancer. There are no specific causes of breast cancer, but there are risk factors to breast cancer. These factors can increase your chances of getting breast cancer.
Women who are older than 50 years old or 55 years old can have breast cancer. And also, if you have a family history of breast cancer, that's also a high risk factor. So there are like high risk factors and low risk factors as well. Also, people taking birth control pills for a long time is also a risk factor. But there are things that you can also change. Gene mutation is a thing you can't change of breast cancer. But then, for example, a risk factor like obesity or like drinking alcohol, because drinking alcohol is also a risk for breast cancer. So those things like being active and alcohol, everything that you can actually change for yourself. There are so many wrong rumors about breast cancer going on. The main thing being that
People think breast cancer only happens in women, but it also happens in men because men also do have breasts, right? Men do have breasts, so it also happens in men. And then I've heard people saying that suckling of the breast reduces the risk for breast cancer, but it's not true. It's only breastfeeding. It doesn't reduce the risk, but it's just below the normal people, someone getting breast cancer. Yeah, you can. And breastfeeding women also do have breast cancer.
and also people think that, as I've mentioned before, people think that people who have a family history of breast cancer is the only person who will get a breast cancer, but then it's not true. Anybody can have it. And also the age doesn't matter. Even if you're young, you can have breast cancer. But the high risk people who are at high risk are the ones who are older.
For those, when it comes to family history, I would advise that we should be able to gather data on our family members, know if there are people in the family that have had breast cancer before, and from the age of 40 years, I should advise every woman to have a checkup on breast cancer, have an annual or biannual checkup on breast cancer. And then also we have to exercise more. Exercise is good for the body, helps the body metabolism. So let us try and exercise more. And then also eat a lot of fruits and vegetables like broccoli. Is said to have some nutrients to reduce the risk factors for breast cancer.
If you have, don't worry. Well, yes, of course you do worry, but don't worry. The doctor can take care of it, and I'm pretty sure nowadays they are good enough to take out the whole part of it. Even though you might lose your breast, that's not the worst thing.
To everybody out there, breast cancer is real and it is not the end of the road. I would like to say that there are different means of treatment. So when you are diagnosed of breast cancer, don't give up. It doesn't mean they are going to take your breast away. There are different stages to breast cancer, and there are different types of breast cancer, and so there's different treatment to breast cancer. So don't give up when you get a diagnosis of breast cancer. There's a treatment out there for you. And then the victims already get to know the diagnosis very well, get to know your chances of survival, and I'm sure that with the grace of God and with the help of your doctors, you're going to live long.
Okay, thank you so much. As it is now, there is no sufficient knowledge on the causes of breast cancer. Therefore, an early detection of the disease still remains the cornerstone to its control. My message to breast cancer victims is that life might be different now, but it still has a lot more to offer. Look on the brighter side and stay happy. Share this video, and together let's increase the awareness of breast cancer. Don't remain in the dark. Let's go pink in October.